When it comes to chiropractic care, everything exists on a spectrum. So rather than jumping right into surgery, Smith Chiropractic is here to help you treat your pain in a non-invasive way. Kenny stopped by to learn which symptoms can be treated at home and which symptoms need immediate attention.
Well, hey, we're currently hanging out here at Smith Chiropractic. I'm hanging out with Dr. Jacobson. Good morning.
Good morning.
All right, you guys see a lot of different issues here at Smith Chiropractic.
Yes, we do.
But when it comes to dealing with pain, like, where do you start with that?
Yeah, that's a great question. You know, this is something that comes up with my patients a lot. And what I find is, depending on the provider that you see, be it a medical doctor or nurse practitioner, it's going to depend on that practitioner where you start. And what I find, a lot of times, unfortunately, a patient's given only a few options for care, and sometimes they can be more invasive and irreversible, perhaps, you know, injections or spinal surgery. And so something that comes up in the office a lot is there's a spectrum to care. On one side, there's very conservative, more safe things, more cost-effective things, and then I find if those don't have the effect initially, it would be pragmatic to start conservative, but then to go to more of the invasive things. And so I find that patients are given more risky, more invasive things commonly, and so a common discussion here once again is that we want to start with things that are easier, you know, things like physical therapy, chiropractic, massage. A lot of times those help. If they don't, and what we do here well is we're going to recommend imaging and then referral to that appropriate person. So
Sure.
Yeah.
So if you have like a pain in your back, don't jump to surgery, right? You want to start with the simple things first to see if they fix it.
Yeah, absolutely. You know, there's things you can do on your own, which is like maybe I need to move my body better. Maybe I need a new mattress, I need to drink more water, and then progression, yes, maybe something conservative. And I'm not the only conservative healthcare practitioner. There's a lot of different things you can choose from, but try that next. You know, I'm a primary spinal pain specialist, so it'd be, I think, logical to start with someone like that.
Definitely. So you don't have to avoid surgery altogether though, right?
Absolutely not. There is necessary need for surgery, so absolutely. I'm not saying that, you know, medications or surgeries are bad. There is absolutely use for them, but a lot of times you can get the a proper treatment or effect without having to go through such invasive things. Yeah.
So with your practice, what issues do you see that immediately you're like, okay, this might be a surgery thing?
You know, a patient comes in with an acute disc problem. Sciatica is the term. Patient has radiating pain, numbness, tingling down their legs. Particularly, those can be managed, but when I find that they're having loss of bowel or bladder function, which is kind of scary, intractable pain, they can't control their function, those are very quickly a referral to an ER department, which are likely surgery, yeah.
Definitely. All right, so what are some of the things that you offer here at Smith Chiropractic?
Yeah, you know, we start with a good examination first. Watching you move, testing your muscles and your joints, checking your nervous system. And then we always take x-rays to see what's going on. And that goes towards what's called differential diagnosis, which is, you know, is it the joint, muscle, nerve that's a problem? And then we're going to recommend appropriate treatment based on that diagnosis, meaning you're not a nail and I'm not a hammer. And so we're going to recommend the appropriate treatment for the appropriate problem. And so we utilize, yes, chiropractic adjusting. We do manual therapy, that's deep tissue massage. Class 4 laser therapy, which helps stimulate blood flow, get your cells to ramp up, helps you heal better. We offer shockwave, which is great for tendinous injuries like tennis elbow, decompression, and then I specialize in disc bulges and herniations, which is a therapy called McKenzie. So we have a number of things we recommend.
Well, where can people find Smith Chiropractic?
You know, we're down just south of Milton Proby, close to Security Widefield, down on the south side of the Springs Fair, yeah.
Boom, there you go. And hey, don't go anywhere because we're still hanging out here at Smith Chiropractic right on Loving Living Local.
Thanks, Kenny. Thanks, Dr. Jacobson. And don't forget about their new patient deal going on right now, too. This segment has been sponsored by Smith Chiropractic.